I'm Dr. Martinez. I do bariatric surgery as a specialty. Number one, because it's a center of excellence. Everybody from the nurses down and all the way up to the doctors are all specialized in taking care of these patients and knows how to take care of these patients well. These patients are already at risk because they're morbidly obese. So being at a surgery center, they may not be well equipped to take care of the patient overnight, wherein complications can set in within the first 24 hours. While at the hospital is very well equipped and all the personnel are well trained to take care of these patients and all their needs. Well, as the word implies, morbid means sick. And when you are big and you're severely obese, you are very sick. That's why we call it morbid obesity. These patients have either diabetes, hypertension, severe sleep apnea, severe reflux esophagitis or GERD, and severe knee pains with back pains. They can also have problems with the heart. They can also have problems with their lipids or the cholesterol, which increases their risk for heart problems. I will give you a story of a patient who had his surgery 6 months ago. The patient was 470-something pounds. He wanted a lap band. And this patient has diabetes. He is on 2 kinds of insulin. He has 4 medications for his blood pressure. He has severe knee pains and back pains. He could hardly walk because he's short of breath. He has severe sleep apnea. And at the same time, he has cardiomyopathy with a 40% ejection fraction. 6 months after the laparoscopic gastric banding, this patient lost more than 100 pounds and no longer is taking any medications for diabetes, left with only 1 medication for his blood pressure and never uses his CPAP anymore for sleep apnea. He's working in the garden and he's got a lot of energy. Being involved in the care of this patient, I would say that I'm very satisfied. It gives you the feeling of extreme satisfaction for giving him a new life, giving him himself again, his self-esteem, the way he conducts himself and the activities that he can do. For patients who wanted to lose weight and who has been struggling with their weight for a long time and has tried all conservative ways to lose weight, we can offer you bariatric surgery, either the lap band or the gastric bypass surgery. These procedures can be provided to you by the Tri-City Regional Medical Center. We have all the specialists that are involved in the care of this kind of patients. StomaFix is a device that decreases the size of the stomach and also the opening between the stomach and the intestine. This is a device that's being used on patients who may have regained weight after gastric bypass surgery, wherein the opening between the gastric pouch into the intestine has dilated, causing or enabling the patient to eat more and at the same time gain weight. With the use of the StomaFix, we can make the opening or the outlet from the stomach to be smaller in order for that patient either to maintain their weight and continue to lose weight. The laparoscopic gastric banding is very non-invasive. It does not entail cutting the stomach. All it entails is a band that goes in the uppermost part of the stomach in order to limit the amount of food that one can eat. The beauty of the lap band is that it is reversible and it is also adjustable. As you lose the weight and as you pursue your weight loss, we can continue to adjust the band in order to decrease the amount of food that one can eat. Depending on the weight loss, we adjust the band. With the gastric bypass, there's no adjustment at this point. The bariatric sleeve at the present time is still considered an experimental procedure. It is a procedure that is not yet covered by the insurance companies. What we do with the gastric sleeve is we decrease the size of the stomach by taking out most of the stomach and making the stomach tubular, coming from the esophagus down to the intestine. By doing this procedure, you limit the amount of food that you could eat. Originally, this procedure was done for gastric bypass patients who are very big and who are very sick. This patient would undergo a second procedure in order to do the gastric bypass. And the first aspect of that procedure would be to do a vertical sleeve gastrectomy to remove most of the stomach out. And these patients ended up losing enough weight that they no longer need the second surgery. It is easy and fast to do. It also eliminates diabetes with appropriate amount of weight loss. It is immediately effective. The amount of food that you could eat is less, and you can attain the same goals with the surgery without rerouting the intestines. Revisional surgery for bariatric surgery is indicated for patients who have regained a lot of weight years after they had their gastric bypass or their lap band. In these patients, recurrence of either diabetes, of all the other health problems like hypertension and sleep apnea is possible, and continued weight loss is not attainable unless a revision is done. Not all bariatric surgeries reduce nutrition. It doesn't reduce nutrition at all. All it does, it decreases the amount of calories that someone would take. The amount of calories that we eat may go beyond what we really need. So it all boils down to the fact that there's an increased calorie intake, less calorie output, and so the calories are all deposited into the fat and we all gain weight. You should be seeing results immediately. In fact, for gastric bypass patients, they go home without any insulin most of the time. Their blood sugar normalizes because of the surgery by itself. All the procedure will only last more than an hour. They're easy and safe. It is safer than being diabetic, hypertensive, and all the other things that comes with the risk of obesity.